Sveiki visi, kurie sekate Health Optimizing naujienas ir laukiate mūsų klinikos atidarimo. Visa komanda šiuo metu tam intensyviai ruošiasi. Besiruošdami ir stebėdami šių dienų įvykius, nusprendėme pasidalinti su jumis keliomis mintimis apie COVID-19 ir sveikatos iššūkius. Šalia manęs viena iš komandos narių, nelietuvė, todėl toliau kalbėsiu anglų kalbą. This is Mihaiela Pentiuc. Mihaiela is a physiatrist, a medical doctor specialized in medical rehabilitation, physiotherapy and physical medicine, a classical homeopath and a great teacher of yoga therapy. Before coming here for 15 years, she was a doctor and one of the founders of a very successful and internationally known private clinic in Thailand. During her practice, she focused on complementary and alternative approaches, holism, personalized treatments, and integration of traditional and modern medicine. She was working and teaching, so she has an extensive international experience, patients, and students from all over the world. So currently, Mihaiela is helping to open Health Optimizing Vilnius, and she is one of the doctors here. Mihaiela, thank you for saying yes to answer to a couple of questions today.
Thank you for having me here. It's a great honor.
The first question then. What do you think about all this current situation with COVID-19 as a doctor?
I believe we have a very complex situation, a unique situation, and while the first measures gave some results in certain countries or didn't give results and we learned a lot of things, there is a lot that we are going to discover later on related with the side effects of these pandemics and of the decisions that we took during this pandemic. While focusing on one particular direction, like fighting with COVID, with the disease, with the spreading of the virus, we forgot about, or we did not pay enough attention to a lot of other problems of health. And those are going to come up more and more to our attentions in the near future.
There are a lot of information these days about the importance of boosting the immune system. But you know, I've read that different parts of the immune system have different purposes and deal with different aspects. Yeah. So what do you think? Is it a right thing to boost this immune system?
One of the characteristics of this period of time was excess of information, of news, of opinions that practically flooded the entire population to the level of which we don't know what to believe anymore. Like treat, not treat, boost the immune system or not. Our immune system is a very complex mechanism. It has innate mechanism, like innate means inborn, common ones, specific ways that we are dealing with aggression from outside or with the problems of daily life. These innate mechanisms are common for bacteria, for viruses, for parasites, for the problems of adapting to weather and so on. But there are also specific parts of the immune system response that are focused on one single kind of aggression, like COVID-19, yes, developing a specific reaction to this aspect, to this aggressor. So when we deal with the immune system, we are not dealing with one-on-one. We are not dealing with a simple mechanism. There are many factors that we take into account, and especially what is most important is the specificity, the individual reaction. Like a person who has a tendency towards autoimmune responses, like people who suffer of autoimmune responses. Let's take into consideration multiple sclerosis, but there are so many others. will have a tendency to attack themselves. The body is attacking itself. So then if we boost that immune system, then we can actually aggravate the basic reaction. So just boosting the immune system because we are afraid of a virus, it's not a solution. We really need to know whom are we dealing with, what kind of immune system this person has. And what's most important, it might be a totally different reaction when it comes to specificities, to the details of this reaction, from husband to wife, from wife to daughter, from daughter to son. So even inside one family, we do not have the same kind of reactivity and the same kind of treatment that needs to be addressed.
Okay, but you know, there were some mothers who anyway wrote to us asking like, okay, we have small children and now the winter is gone and this is spring, so maybe can we give them at least vitamin C, or I don't know, give some fresh juice or vegetables, more of them? Yes. Maybe this at least somehow could help?
Yes, there is this idea, I know, we heard about a miracle treatment, a new miracle treatment, a new miracle mushroom is in town, so let's take it all. Or even when it comes to the simple vitamin C, everybody needs vitamin C. But the reaction and the amount of need of vitamin C is different from one person to another. Some people will do good and will need quite a lot of going to 2,000 milligrams a day, but there are people who react much faster, so then we need to observe. And when somebody, for example, reacts with diarrhea to a certain amount of vitamin C, that's enough. Boosting it and taking more, it's not helpful. So even here, while we encountered new information, while we hear about miracle juices, yeah, we have to see, is this good for me? Is this good for my son? Is this appropriate for the kind of condition of health or health challenges my son or my daughter or myself are having?
Okay, thank you. There is another interesting and quite popular, actually, question. Usually we think that we are probably sick when we start to feel some kind of symptoms. So does a symptom or group of symptoms means that there is a disease already? Because very often we are treated because of the symptoms.
The symptoms are most of the time mistaken as our enemies. I start having some symptoms, consequently my body failed me. I got sick. Actually, the symptoms are the signs of the body fighting the problem. They are part of the solution. Having no symptoms is not necessarily completely healthy. It can be very healthy because the immune system, the body, fights with the disease really efficiently at a lower level and is not fully perceived. But it is very important, really very important, to shift our opinion towards the symptoms that the body presents, towards the signs of a certain disease. They are not our enemy, they are our friends. They are actually our signal, the call for attention. For example, fever. Fever is the raising of temperature in the attempt that the body does in order to destroy the virus, the bacteria. The virus is destroyed at high temperature. So this is a very sane mechanism. Or pain. pain is a very powerful call of attention. Stop what we are doing and pay attention, there is something wrong. Attend to the body, attend to the mechanism, pay attention here. We take pain medication, and then we continue our work, we continue our daily life while the problem has not been fixed.
Yes, because we need to go to work or something.
We need to go to work, but at the same time, behind there, some mechanisms are not functioning well. So there is a very fine line, and at the same time, it takes a lot of wisdom and careful attention to dealing with taking a perfect decision about when to stop a symptom, when to attend to it, and how to help the body which presented certain symptoms. Yes, it is true. Very high fever for a very long time is non-sustainable. The body can get exhausted, and it can reach to problems of the nervous system, and is not good. So too high of a fever is not good. But jumping directly into stopping the first few degrees above normality, it's not good either. It's not smart either, because this is how the body attends to a virus. So while we are reacting in a panicky way to what we hear, yes, we have so many weeks now of staying home, dealing with the virus, disinfecting everything, protecting ourselves. So the first panicky time are gone. And now is the time to start looking at our problem in a cool way, in a smart way. What are we dealing with? Yes, it's not as simple as, okay, there is a virus, take an antiviral medication, problem solved, go back to work. Yes, viruses are much more complex than this. We have this mentality which came from the big success of antibiotics in the modern medicine, that if there is an infection, we identify the bacteria, we give the antibiotics, and ta-da, miracle is happening. Yes, that is valid, and it is one of the miracles of modern medicine. But here we come, we deal with COVID, or with SARS-CoV-19, yes, with a virus, and it doesn't work that easy. So now is the time to really look into the complexity of the reactivity of our body, to make friends, so to speak, with our immune system and our body responses, to understand when to interfere and when not to interfere, because it's not necessarily that we are dealing with a failure. The reaction of our body, of ourselves, to a certain aggression or another, to COVID-19, is influenced on different levels. There are specific reactions related with the physical parts, with the anatomical physiopathology. For example, we do have these mechanisms of protection. Yeah? Respiratory system, there are the hair-like projections along the airwaves, and these hair-like projections are absorbing the droplets, the famous droplets with COVID, and slowly through their movement moves them out of the airwaves, and they don't get up to the alveoli, to the deeper parts of the lungs. Now, the problem is that these cilia, these hair-like projections, are paralyzed, or they have an impeded movement when smoking, whatever kind of smoking. So different people are going to react differently. Or if there is an bacteria, microorganism, or a virus that we introduce inside ourselves with the food, if there is enough acid in the stomach, then most of these bacteria and viruses are going to be killed, and we are not going to have consequent problems to it. But if we take antacid medication because we heard it's good when you are stressed to take antacid medication, or because we eat very fast and then there is some acidity, some heartburn, and then we need to put, to put this fire down, then those bacteria and viruses are not going to be killed. There is not enough acidity in the stomach, and consequently we are going to suffer quite a lot of digestive imbalances later on. And later on means also that the gut flora is going to be influenced, and the gut flora is the main training space, the main training place for the immune system. And consequently, a fact that we have enough acid in the stomach or not is going to influence the immune system, the way the immune system reacts to the virus. So it is very important to find out how much acidity am I have in the stomach. Is my stomach reacting well? Especially if I know that there are ongoing digestive problems, or there are dietary incongruences, or I'm eating what is not good. So you see, there are different reactions and different levels. This is on an anatomical, physiological level, but then there are very deep interactions that we very well known at this moment between our mental emotional background and the way the immune system works. When we panic because we heard there is a new virus in town, then there are direct mechanisms that are going to suppress the reaction of the immune system. Or if the immune system is depressed through certain kind of medication or certain kind of dietary problems, then the mental emotional level is going to suffer, and then we are more likely to be inclined towards anxiety and depression. It goes both ways. And then knowing very much our mental emotional characters, it's very important. It becomes really important to know oneself. Who knows what is their default reaction? Okay, when there is too much time at stand, yes? We are all now forced at home. There is no more work to distract us, there is no more boss to ask too much, and we are home, and after a few days of jumping from food to sleep to TV to sex and back to food, and all of them become boring. So then how do we react? Yes? How do we have that reaction? Anxiety, depression, restlessness. We need to go out. No, you cannot go out. All those are going to influence our brain, are going to influence our mind, but they're going to influence the immune system. And then the immune system is the one that is fighting. Yes? So there are interactions on many, many different levels. Let's take the spiritual level. And I'm not talking here about religion. Yes? It's not about a religion. Spiritual part of our being is most connected with our perception of purpose and meaning of life. It is quantified already that having a clear purpose or a clear feeling of meaning of life is going to impact the rehabilitation, the recuperation, the way a person or a patient is going to recover after heart attack, after an acute, after fever, after COVID-19. So seemingly unrelated aspects of our being, of our body, have very deep influence on the immune system, on how we react to this situation. This is why there is so much diversity around us.
Here at the Health Optimizing clinics, we use many different technologies. What do you think? Can technologies be useful in some way in a current situation, even today? Usually we hear a lot about medicines and vaccines, but not the technologies.
There are two main big categories of treatment therapies that we apply to the body. The most known category is the chemical applications. There is a bacterial infection, take an antibiotic, take something, go to the doctor gives you a pill, you take the medication, you go home and you're happily cured. Yes, hopefully. There is also another category that is less known or less applied, and this one is of the physics therapy, the therapies that belong to the physics. Until now, in the medicine, the classical medicine, there was mostly physiotherapy, the part of my specialization, where you will apply certain electrical currents to deal with pains, with rheumatic problems, and so on and so forth. So this were the extent of this development. But with the modern science, and especially with the development of quantum physics and high interest of people for technology, there is a booming development of technologies applied to medicine. And this is what health optimizing is about, introducing this trend of physics into treatment. While we have the mentality, the classical mentality, I have a problem, I have a symptom, I go to the doctor to give me a good pill. Now we can build up and we can add the fact that yes, I go to the doctor and it gives me a procedure, a technology, a certain program that I can use in order to help my body deal better with that problem. And these technologies are not necessarily addressing, as we are used with, a certain organ or a certain tissue. An organ and the tissue are made of cells, are made of certain components, chemical components, yes? They have a certain frequency which belongs to the physics of it. And these technologies are going to address the function of the cells themselves. So it is like an underlying mechanism that is going to support the general function of the organ. So technologies are brilliant in this direction. They are less known, less trusted, but they are developing and they are the future of medicine. So I believe that very soon we are going to change our minds. Yes, it's not necessarily, oh, give me the best pill, or what is the best supplement, or what is the best chemical that I can put in. No, what is the best application? What is the best procedure? How can I support those cells that are now suffering or are fighting with? How can I attend to this body with the support of technologies?
Okay, it's very interesting. So I believe that, that's my last question, Mihaiela. I believe that there are going to be more viruses in the future. So what we all could learn from this COVID-19 situation related with health, what would you wish to our followers, those who are waiting for the health optimizing?
There are so many viruses. There are more viruses in the environment and in our body than bacteria and cells we have in our body. Not all of them are aggressive, yes? It's actually less than 10% of the viruses that are out there that are aggressive to us, that are dangerous, infectious to us. There are viruses inside our body right now being healthy and cohabitating with us, the way there are bacteria in our body that cohabitate. There are more bacteria in this body than cells, and we live together. And they are actually, some of them are essential for our life. So again, I come to the idea before, fighting one-on-one. This is me, my cells, my tissues, and you, bacteria and viruses, are the enemies. It's not very smart. It's quite primitive. Yes, it's me and the others. We are advancing towards a mentality of cohabitation, of integration, of interaction, of smart interactions, rather than disinfecting everything and going to complete aseptic environment. We actually start thinking now, no, we need a good connection with whatever else is around. We cannot exist on ourselves purely. There have been studies on mice and rats who had no bacteria in their, no gut flora in their intestines. They were poor little animals. They were depressed, anxious. They were unable to develop their intelligence. So consequently, we need an infusion of this, of this healthy gut flora. So it is the time to address the details, the complexity, the integration of everything that we are and everything that our environment is. And then we develop what is called resilience, adaptability. It's not a matter of complete protection and shutting down everything, although that is necessary, as it was proven already during this crisis, but now it is the time to integrate. It is the time to adapt. It is the time to develop our ability to be resilient. There are people who say, I'm very healthy. I have no symptoms, I had no reaction of this, but I am very healthy as long as I have a very strict diet, a very clear program of life, a very hygienic program of life. As soon as the sleep is disturbed or a minor indiscretion in the diet occurs, things are not going well. That is not health. That actually is a person who has a very low buffer of health and a very low ability to adapt. Yes, we need a good diet. Yes, we need a certain amount of sleep. We need a very good lifestyle. And we need the ability to adapt. We need to be able to function well when not everything outside is perfect. I want to end with this idea that it is the time to optimize our health, not just be happy with no symptoms. Health is much more than no symptoms. And this is even included in the definition of health of World Health Organization. Yes? Health is not just the absence of disease. Yes? Health is a matter of being able to adapt to the challenges of this life. Either they are physical, bacterial, biological, chemical, viral, but also mental, emotional, stress, and the likes of it.
Ačiū, Mihaiela.
Ačiū.
Ir ačiū visiems, kurie žiūrėjote ir klausėte iki pasimatymo klinikoje.